Okay, so we will start from where we stopped. The next slide of the presentation. We will call it lecture 2, but it's the continuation of the previous lecture, which you must have gone through now. So then this concept of gray matter and white matter, which you all know, I think, this Dusara Dravya and Sweta Dravya in Sinhala. Dusara Dravya is gray matter and Sweta Dravya is white matter. So gray matter is the areas where you get cells, collection of cells, which appear little dark. And white matter is the area you get nerve fibers, axons, myelinated ones. So because of the myelin sheaths, you get this whitish appearance. Now, what I want to raise here is that in the brain, you get gray matter in the cortical areas. In this area, you get the gray matter outside. White matter you get inside the brain. So you get cells outside and fibers inside. When it comes to the spinal cord, on the other hand, you get cells inside, gray matter inside, and white matter, the nerve fibers, outside. So that is one point that you need to remember, which is a very simple point. Now, what is the advantage of having this? Just to see why this has happened. Now, in the brain, there's a lot of functions in the brain that we even don't know. You need a lot of cells in the brain. You know the surface of the brain has sulci and gyri to increase. It's vastly increased in area because of the sulci and gyri. So it can accommodate when you have the cells outside rather than inside. It can accommodate many more cells. So that is the advantage of having the cells outside in the cortex when it comes to the brain. Then the connections, the fibers will go into the center and will go down. On the other hand, the spinal cord, even though there are certain functions at the spinal cord level, like reflex functions, what are reflexes, pratika chapa, reflex functions, and you have all these interneurons connecting up in between neurons, between other neurons. For that matter, you have to have cells in the spinal cord, but the main function of the spinal cord is to it's like a highway. Nerve fibers has to go up and nerve fibers has to come down. And they have to, there are 31 pairs of spinal nerves. So at each spinal segment level, this nerve fibers has to leave the spinal cord. So if you have cells outside and fibers inside, at each point, the fibers will have to go in between cells, which will vastly increase the size of the spinal cord. It would be about 100 times more than the spinal cord we have if we have that arrangement where the cells are arranged outside and fibers are inside, because the fibers has got to leave the spinal cord at different points. So it's better it is outside. Now, even in a highway, when you enter a highway, you enter the highway from the side, and for some distance you travel in that track. You know that. You don't directly enter the center. So that's the arrangement in the spinal cord also. Then later when you do the nerve tracks and all, you will see some other advantages of the arrangement of fibers. Now, if you get say sensory fibers entering the spinal cord, you just take this area, the posterior area. You will learn these things. Dr. Himani will do the lecture. Nerve tracks, when you study, you get say sensory fibers coming from the lower limb will go to the midline. It will not cross the midline and go up. Then upper parts of the lower limb, the fibers are coming, will get packed next to it and go up. And from the trunk and upper limbs, then the fibers will go like that. So they don't cross each other. If these initial fibers, if they were going up like that, and the upper limb fibers will have to cross like this, then that will increase the size of the spinal cord. So remember these points, evolutionary or whatever. This is how they are arranged. You will learn this when you do the nerve tracks. So with that, so remember this gray matter and white matter, how they are arranged in the brain and the spinal cord, and the Reasons, nobody will ask you the reasons why they aren't like that, okay, because these are all other speculations, other than that, there's nothing much to it. Then I will have to remove the video, I think. Okay, I'll remove it from here. Okay, then the other point is the cortex, the gray matter of the cortex. Now this is actually this whole area, this whole area is the cerebral cortex. It is enlarged here to show you that there are several types of cells in the cortex, in the gray matter of the brain. There are actually, if you count, there are 5 types of cells organized into 6 layers. There are 6 layers, 6 cortical layers in the cortex, and there are 5 types of cells found in these 6 layers, sorry, cortical layers. Now you can remember, that there are 6 cortical layers, and you can remember that there are 5 types of cells. That much is enough at your level. You don't have to remember the names of these cells or the names of all these layers, molecular layer, external granular layer. You don't have to remember that, okay? But later, if you do psychiatry or something for your clinical training, then you will have to remember, because there are drugs acting on the cells, particular cells, and particular layers of this cortical structure. So for that reason, you need to remember it later. But for the moment, remember that there are several cortical layers and several cells in the cortex of the brain. Now, when I ask you not to remember the names of the cells, except one. Now, this cell is a pyramidal cell. Now, the pyramidal cell is very frequently used term. You will have to remember the name of the pyramidal cells. But the important thing is the pyramidal cells are found. They are found everywhere in the cortex, but it is important to remember that there are pyramidal cells. Now, if you have the brain like this is the central sulcus. You get the motor cortex here, primary motor cortex. Now, in the primary motor cortex area, there are pyramidal cells. Some cells are, pyramidal cells are very large. They are given different names, bed cells and all that. You don't have to remember all these terms, I think. And these cells will give rise to motor fibers starting from the precentral gyrus or the primary motor cortex. And most importantly, these fibers starting from these the pyramidal cells, primary motor cortex, will travel through. When you learn about the medulla later, you will understand. Take a different color. Now you draw the medulla. This is the center. You get what is called pyramid, and then you get olive on other side. So you will learn these things. Okay. Now, if this is pons and this is medulla, now this pyramids of the medulla actually contain these nerve fibers, motor nerve fibers going down into the spinal cord from the brain, will travel through the pyramids of the medulla. And it is some of these fibers starting from the pyramidal cells will be there. So maybe because of that, these are called pyramids, because fibers starting from these cells go through this. So I don't know how it started, but anyway, remember these pyramidal cells and the pyramidal tracts and the pyramids of the medulla. You will learn these things gradually. Okay, you can't learn everything at once. So that is basically about this. So my point again here: don't try to remember the names of these cortical areas or the names of the cells except the pyramidal cells. So that is the take-home message. Then about the white matter further, you know that they are myelinated nerve fibers. So even in the central nervous system, nerve fibers are myelinated for rapid conduction. And these white, or the white matter or the nerve fibers are classified into 3 groups based on their function. Now the first group is, you call them commissural fibers, and the second group is association fibers, and the third group is projection fibers. Now commissural fibers are the fibers that connect corresponding regions of the two cerebral hemispheres. Corresponding regions of the two cerebral hemispheres, because you have the cerebral hemispheres like this. You have the left and right cerebral hemispheres. The two corresponding areas of the cerebral hemispheres can be connected by these commissural fibers. So they basically has to pass through, have to cross the midline. They have to cross the midline and go to the other side. The best example of a commissural fiber tract is the corpus callosum. Then the other examples are the fornix, anterior and posterior commissures. So they are the main commissural fiber tracts you get in the brain. Therefore, you will have to identify them. These two are pretty small, but if you know where they are, you can identify them. And these two are, if the specimen is clear, this of course, you can see in all sagittal sections, but fornix can be seen if the section is taken right at the midline. You will cut with the fornix. It's very small like this. Therefore, when you cut with these brain knives, it gets damaged. It gets pushed to the side and gets damaged. So it's not easy to find fornix clearly in the specimens. Anterior and posterior commissures, of course, if it is a good specimen, can be found. You will have to identify them in your exams sometimes. But you cannot forget the corpus callosum, okay, which is the most important commissural fiber collection. And corpus callosum has several parts to it. We will go through these parts in a diagram. Rostrum, genu, body, and splenium. We will go through it. Now, this is how you see these things in a specimen. Now, this, if you cannot recognize what it is, this is a mid-sagittal section of the brain. Now, the way I can see it, now this is the right cerebral hemisphere that you see here. And the left cerebral hemisphere has been removed in this specimen. So you see the corpus callosum here. Very clearly, you see the corpus callosum here with its different parts. Now, this part of the corpus callosum on the anterior side, this is the anterior side, okay? And this is the posterior side. This is superior and this is inferior. So this is called rostrum. This part of the corpus callosum is called rostrum. And this is a bend, so you call it a genu. Okay, bends are called genu in anatomy. And this is the body of the corpus callosum. And this area is called the splenium of the corpus callosum. So you have a rostrum here, genu, body, all these are body, and then you get the splenium. These are the four parts of the corpus callosum. Then this is the fornix. So this section has been taken in such a way not to damage the fornix. So this is, you will learn these things. This is septum pellucidum, very thin layer of tissues separating two cavities on either side. When you learn the ventricles towards the end of this lecture, you will see this. This is called septum pellucidum. I'll show you later. So, so then, now we are discussing the commissural fibers. So remember this, this is corpus callosum and this is fornix. And this is anterior commissure. I said they are very small. So this anterior commissure is found between the anterior end of the corpus callosum. This is the end of the rostrum. This is the end of the fornix. So it's almost between the two. You get this anterior commissure. And this posterior commissure, the other commissural fiber tract, I don't know how much you can identify the structures of the brain by now. You haven't done the brain stem yet, but if you look at this carefully, now this is now we are doing the cerebrum here actually. Now this is the area of the diencephalon that is hidden inside. Now this is the brain stem. This area is brain stem. And then this is midbrain. Sorry, this area is midbrain of the brainstem. This is the pons of the brainstem, and medulla lies lower down. Now, my point here is that now, if you look here, you can see this is the diencephalon. This is the pineal gland, which is part of the diencephalon. We'll get back to it later. And this is the superior colliculus and the inferior colliculus of the midbrain. This is the cerebral aqueduct, your Sylvius Martikawa in Sinhala. Now you can identify this area between the pineal gland here and the superior colliculus of the midbrain. This is pineal gland of the diencephalon. Okay, and the superior colliculus of the midbrain. Between the two, this is the posterior commissure. Between the two, you get the posterior commissure. Now I'll delete it so that you can see it clearly. Okay, so that is posterior commissure. So you get this anterior commissure, posterior commissure, fornix and corpus callosum. These are the commissural fibers. These different parts of the corpus callosum I mentioned. So these are the different parts of the corpus callosum I mentioned. You need to, sometimes we ask you to specifically identify this area, whether it's genu, body, or splenium. In a sagittal section, we can ask you to identify. Then this is a specially prepared specimen, I think, not our specimen. I got it from the internet. You can see when you look from above, with the superior view, with the cortex removed. That's why I specifically wrote it. With the cortical parts, superior cortical parts has been removed, and they have used some staining method as well to show you these fiber tracks very clearly. Otherwise, you don't see the fiber tracks as fiber tracks like this. So you see now this is the corpus callosum connecting the corresponding areas of the two cerebral hemispheres. You can see corresponding areas are connected like this. So even at the back, this is the occipital area, this is the frontal, and this is the parietal, and temporal would be lower down. So then it's a very large collection. It's a very large commissural fiber collection connecting the two sides. Different names are given to this part and this part, forceps minor and forceps major. It's not very important, but I'll show you in a different diagram. Forceps minor and major. Then the other point is, if the brain is cut like this, coronal section, this is what you see. So it's a section parallel to the coronal suture. You know that coronal section. So then this is how you see the corpus callosum. Now this is your brain cut in coronal section with the temporal lobe here. Then again the temporal lobe here, and this is the brain stem. Okay, this is the brain stem area. Now this is actually, now you get the cerebral. You get your, I'll draw it here. You get your falx cerebri. You know, dura mater here. Dura mater is like this. Okay. So then you get your corpus callosum here. This is how the corpus callosum is cut. Okay. If you go back, so it's cut like this. It's cut like this in the coronal section. Okay. So you see it like this, and below that, what you see is the cavities in the brain, which are called lateral ventricles. You see the two cavities here, and this thin sheet, which I said septum pellucidum, separating the two cavities. We'll come back to it later. So remember the position of the corpus callosum in a coronal section. Again, you can see the corresponding areas are connected by these fibers. Okay, that much is enough. So this is how the section has been taken. Okay, so this is what I wanted to mention. Now in this diagram, you can see different names given for different parts of the corpus callosum. You don't have to know that, but just for the sake of completeness. So this anterior end, where the fibers pass through the rostrum, that area, when you look from above, you call it forceps minor because it's smaller. It's not wide as this one. This is wider. This is called forceps major. Now this is the rostrum area. You get this, and this is the splenium area at the back. Okay. So forceps minor is this area going through that. Forceps major is that area going through the splenium area. Okay, then you get the middle. Okay, we did all this. Then the second type of fibers. Now we were discussing about the different white matter arrangements. First one is the commissural fibers. We said corresponding areas of the two cerebral hemispheres are connected by the commissural fibers, and we discussed different types of commissural fibers you get in the brain. Then the association fibers. Association fibers connect different cortical regions within the same cerebral hemisphere. Commissural ones connect corresponding areas of the two cerebral hemispheres. Here the association fibers connect within the same cerebral hemisphere. They connect different cortical areas for proper functioning. Now they can be divided into two groups: short association fibers and long association fibers. Now short association fibers are very simple. Uh, Short association fibers are like this. If you get the sulci and gyri like this, short association fibers connect adjacent gyri to each other. They are connecting adjacent gyri to each other. On the other hand, long association fibers, if I draw the brain like this, long association, if this is one cerebral, if this is left cerebral hemisphere, long association fibers will connect very distant areas from the cerebral cortex to each other. Now, one good example is, I don't know whether you remember when I showed you about the functional areas of the brain. Functional areas means the motor and sensory organs or structures represented in the brain. We talked about the homunculus, motor and sensory homunculus, and other areas where functions are represented in the brain. Then we said in the frontal lobe, inferior frontal gyrus, you get what is called Broca area. Broca area, motor speech area, Broca or Broca's area. Then in the parietal lobe, you get another area called Wernicke's area. You will learn these things when physiology starts. Okay. Wernicke's area. Now this is called motor. This is motor speech area. This is sensory speech area. And the point here is that these two areas, they need to function together. If the Broca's area does not receive information from Wernicke's area, then you will the speech of the person will be irrelevant to the topic. So it's like in Sinhala you call koheda yanne mallepol. So that type of speech will be there if these two are not connected. So this connection is actually done by a group of long association fibers. Actually, you don't have to know these names, but you call that arcuate. Arcuate. When these long ones are there, you give them another name. You call it fasciculi. So you can call it arcuate fasciculus. Arcuate fasciculus. Now the nice thing is sometimes some people, maybe due to tumors or something, you get this arcuate fasciculus, long association fiber tract connecting the Broca area and the Wernicke's area can get damaged. So then you know what will happen. So there will be irrelevant speech. They can talk, no problem with the with their talking, but it's not relevant to the topic. Okay, Mallepol kata. Remember this point. Interesting. So I just wanted to show you. So association fibers would be like these long ones. Short ones would be connecting the adjacent gyri. Okay. Then the projection fibers, third type: commissural fibers, association fibers, and projection fibers. Projection fibers are again long fiber tracts. They can be either sensory, you call them sensory or afferent, or efferent or motor. So both there are sensory projection fibers and motor projection fibers. They pass between the brainstem and the cerebral cortex. So motor ones will start from the cerebral cortex and go into the brainstem, and the sensory ones will start from the brainstem and will go into the cerebral cortex. So then these are called projection fibers. So now if you summarize, commissural fibers connect corresponding areas of the two cerebral hemispheres. Association fibers, they connect areas of the same cerebral hemisphere for proper functioning. And the projection fiber, they actually connect the brain stem to the cerebral cortex, either through sensory or motor tracts. Now the best example of the projection fiber tracts is the internal capsule. So you will learn about the internal capsule in this particular lecture and in other lectures. So the internal capsule contains sensory and motor projection fibers from almost all the areas of the body to the motor and sensory, primary motor and primary sensory cortices of the brain. Then you get beyond the internal capsule, you get what is called corona radiata, optic radiation, all that they are related to each other. Okay. So it's the same nerve fiber tracts that you give them different names at different places. Okay, give it some time, you will understand it. Okay, I'll show you some of the things here. Now, this is a beautiful, specimen. Not our specimen again. I got it from internet. Now, in this one, I'll try to draw and show you some of the things. Now, this is roughly, I will call this the central sulcus. This area, I think it is central sulcus. Now, if that is central sulcus, this is to tell you about the projection fibers. Okay. If that is central sulcus, so this should be the primary motor cortex in front of it, precentral gyrus. Okay, and behind that would be the primary sensory cortex, postcentral gyrus area. Then now this will have motor fibers. Sorry, this will have sensory fibers coming into that area, and the motor cortex will have motor fibers starting in this area and going down. Now, the internal capsule is this area. Draw it in black color. Internal capsule is this area. It's like this. Okay, it has a anterior and posterior limbs and a genu. Genu again. Genu is a bend. Okay, you can see that. I'll label it later in a different picture. Now, these motor fibers that are starting from the precentral gyrus, the motor cortex, will go down through the genu and the anterior part of the posterior limb. Can you see that? They go down through the internal capsule like that. And this is the cerebral peduncle is in the midbrain. You haven't learned these things yet. Okay. Cerebral peduncle is on the anterior aspect of the midbrain, madhya mastiska. So it goes through the cerebral peduncle, middle part of the cerebral peduncle. You will learn this later. Don't get afraid. Okay. Then through the pons and different parts of the medulla, and there are named nerve tracts, motor nerve tracts going through the spinal cord, and motor nerves can come out through the cranial nerves. You get these cranial nerves in the brain stem, come out through the brain stem cranial nerves, or can come out through the spinal nerves. Similarly, sensory fibers starting from different parts of the body which enter the spinal cord from the left side or right side will ascend through some of these sensory nerve tracts, go through it does not they go through the upper part of the midbrain, not through the peduncles as motor fibers. They anyway go through the midbrain. That is what I need you to concentrate here. Then go through the posterior part of the posterior limb of the internal capsule behind the motor fibers. Then they go into the sensory cortex. Okay, so this is basically the arrangement of nerve tracts. So this area is called internal capsule, where these projection fibers pass, because they pass from the brain stem here to the cerebral cortex. The initial part in the spinal cord is not considered. You just consider the brain stem and the cortex. Then now this is a very small area. This internal capsule is a very small area like this compared to all these nerve fiber tracts going. So they go through a very small area. Then the brain, the cortex, is a very large area. Okay, so they not only go into this precentral and postcentral gyri, they go into many other areas in the brain like this, motor and sensory both. Therefore, whatever that went through this very small area, narrow area, will have to fan out like this to the whole cortical area. So that fanning out is here, which is called corona radiata. So it's a radiation all around. The posterior most part of this radiation is called optic radiation, because that is going into the occipital cortex calcarine sulcus area where the vision is possible. So that the posterior end of the corona radiata is called optic radiation. Okay. So coming back to our list. So internal capsule, you have an idea now. You have an idea about the corona radiata and also the posterior part of the corona radiata, which is called the optic radiation. Okay. So this is a beautiful diagram. Now I have made it very ugly. Okay, so anyway, I will not try to delete it. So look at this diagram carefully later when you get the lecture PDF. Okay. Again, another way of looking at this. Now this specimen has been done in such a way by, now this is the right cerebral hemisphere and this is the left cerebral hemisphere. Now you can see someone has dug into the left cerebral hemisphere and removed some of the parts here to show you the internal capsule. Okay, so I'll show you where it is in horizontal section later. Now again, the same thing has been done here. Whatever that has been removed in this area in this specimen is kept without removing in this specimen. So you see the other side of the cerebral hemisphere. This side, the left side, the cerebral hemisphere has been totally removed. That's why you see the medial aspect of the right cerebral hemisphere. Otherwise, you will not see it. You don't see it here. No? So this one, the left cerebral hemisphere is intact partly. Okay, this one, cerebral hemisphere has been removed, leaving some of the internal structures here, which are called basal ganglia. I'll come back to it. So to show you that the internal capsule passes between some of these structures. Now this is the left thalamus. This is the left the basal ganglia. I'll come back to it. In between the two, you get the internal capsule passing. Okay, so this is how it passes to the cerebral cortex. So in this diagram, it is clear. Now this is the part actually left. This part here is here. So this black one is the thalamus I said, that is here, this one, thalamus. Okay, of course, this also you will be able to see it, caudate, this part in anteriorly, and you can see that, if you look from this side, if your eye is here, that's how you see it. So this specimen has been prepared like this. This whole area has been removed. Whole area has been removed to show you the view from this angle. You see, look at it from this angle. So you see it like this, the previous diagram, this one. Okay, this diagram. So this is the internal capsule. This is the anterior limb of the internal capsule. And this is the posterior limb of the internal capsule. And this is the genu of the internal capsule. Okay. Now in the previous diagram, I was trying to show you that the internal capsule will have motor fibers occupying the genu and the anterior part of the posterior limb, and the sensory fibers will occupy the posterior end, and the optic fibers will occupy they are also sensory in further behind. Okay, so we'll come back to it later anyway. So this is to give you some idea about the internal capsule. Okay, now we will talk about basal ganglia. Now we have discussed about the gray matter and white matter. We have said if you take the cerebral hemispheres like this, you have gray matter outside and white matter inside. So that was the basic discussion. Now in certain areas of the brain, you have already seen, you get collections of gray matter like this. Collections of gray matter within white matter. Now, some of these collections of gray matter, not all, some of these collections of gray matter, then you understand, the moment I say gray matter, it's collection of cell bodies, neuronal cell bodies, are called basal ganglia. Not all, okay, some of them are called basal ganglia. So remember that point. And the basal ganglia are important. They have an important function when it comes to cognitive higher level programmed learned procedures as well as movements. So when you have problems with the basal ganglia, you get movement disorders. We'll come back to it anyway. So the basal ganglia is gray matter found within white matter, but not all gray matter within white matter is called basal ganglia. And sometimes these collections are, they are not called basal ganglia. Sometimes these collections are called nuclei. Okay, sometimes they are called nuclei. You will see, when you get them. So then these are the types of basal ganglia you get in the cerebrum. The corpus striatum is the first one, which is a very large basal ganglion. Corpus striatum, you have seen it already. Corpus striatum is where you get this internal capsule. We said the internal capsule is there like this in horizontal section. On this side, you get this large basal ganglion, these two. Now this is called lentiform nucleus. Okay, lentiform nucleus, and this is called now this is the midline of you get the other cerebral hemisphere here. This is caudate nucleus, part of the caudate nucleus, which is called the head part of the caudate nucleus. Caudate nucleus is something like this. Okay, so it's like a C. So only this part we are referring to here, head of the caudate in a horizontal section. Okay, so this head of the caudate nucleus and this whole lentiform nucleus on either side of the internal capsule, they are together called corpus striatum. Okay, that's why the text says here the corpus striatum is divided into two by the internal capsule. Okay, it's true, no? Internal capsule divides it into two. Now you might wonder why they are put together, because there are two structures on either side of the internal capsule, because they function together. Later, when you learn physiology and pharmacology in your third year, you will see there are reasons why they are put together rather than taking them separately, because they function together. So remember this term corpus striatum. You can divide them into two parts, caudate and the lentiform nucleus. Then the lentiform nucleus, if you look into the details of that, lentiform nucleus also has got two parts. It's like this. This is called putamen. People pronounce it in different ways. Some call it putamen, some call it putamen, and you can call it putamen. And this inner small one is called globus pallidus. Okay, so ultimately you have a globus pallidus and a putamen, globus pallidus and putamen forming what is called lentiform nucleus. Then you have a caudate nucleus, which is like this, only the head is seen in this view. Very long caudate nucleus. Caudate nucleus and lentiform nucleus together can be called corpus striatum. Corpus striatum. Then the other two basal ganglia found in the cerebrum are the amygdaloid and the claustrum. I'll show you when I get the opportunities. Amygdaloid and claustrum. I'll show you. Okay, some things are here. Now, okay, this is the diagram that I was referring to. This is a horizontal section of the brain. Actually, to get this section, to get some idea, you have to cut very low. You have to cut about 1 centimeter above the inferior surface of the frontal lobe. If you look at the brain, if you cut here, you will not see this. Okay, so you cut it very low like this and look from above. So that's how you see this. So in this diagram, you can see what I tried to explain. You see the head of the caudate nucleus here, and you see the lentiform nucleus here with the putamen and globus pallidus. This is thalamus. Now that is also seen dark. You don't call it a basal ganglion. Just because you see it dark, you don't call it basal ganglion, but there are a lot of cells. That's why you see it gray, but that is thalamus. Thalamus is not a basal ganglion. Okay, and all these gray areas in the thalamus, they are not called basal ganglia, but they are called thalamic nuclei. I told you, sometimes you call them nuclei, the cell collections. So coming back to this, you get the internal capsule here, very nicely seen in this diagram, in this picture. And this is the posterior limb of the internal capsule. Okay, and this is the genu. This is the anterior limb. This is the genu. This is the posterior limb of the internal capsule. And if you go to the other side, together these two divided by the anterior limb of the internal capsule here, together they are called corpus striatum. Actually, there are connections between the two also. Okay, you will learn. So that is called corpus striatum. Now, this amygdaloid, the other one that I was referring to, amygdaloid, this one, you can see in this model, 3D model. Now, try to understand this. Now, this section, this diagram is a section like this, horizontal section. Okay, so having that in mind, if you look at it, then you can see if you cut in that direction and look, if your eye is here, look from there, like in this diagram, first diagram. This is globus pallidus and putamen, that is lentiform nucleus. Okay, and you get your head of the caudate nucleus on the medial side and the thalamus on the medial side. This one and this one. Thalamus and the head of the caudate nucleus on the medial side. So the internal capsule actually passes through this, like this, between the two, and you get the corona radiata radiating all the to all the structures. Now the head of the caudate, I said it is here, head of the caudate, and this is the body of the caudate, like a C. This is the tail of the caudate nucleus. Now when it comes to this part, it is the temporal lobe, and it ends at the amygdaloid nucleus. So it's a rounded nucleus. If you draw the brain here, it might not be exactly correct when I draw it. So brain will be drawn like this. Okay, I'll take a different color. Okay, so this is the temporal lobe. Okay, and this is the frontal lobe, like this. So the caudate nucleus here starts from the frontal lobe area, passes through the parietal lobe, and maybe partly through the occipital lobe, not very sure. Then it goes into the temporal lobe here and ends in the temporal lobe, and very close to it you get the amygdaloid at the end of the tail of the caudate nucleus. Claustrum, this one, claustrum, I'll show you the claustrum in a moment. Maybe I can show you here before you go further. Claustrum is this one. You can see a very faint gray matter area here, like a very slender line. That is claustrum. So that is just lateral to the lentiform nucleus, claustrum. Okay. So this now you get different cortical areas we call premotor cortex, motor cortex, sensory cortex, like that. Now this cortical area here, hidden. Now this cortical area cannot be seen outside. To see that, you have to separate the lateral sulcus here. You remember lateral sulcus? Between the temporal lobe and the parietal and frontal lobes. Now, if you separate this out, this part with your fingers, you can see this cortex hidden inside the lateral sulcus, which is called insular cortex. Insular cortex. Now, why it is related to the claustrum is that you can see claustrum is immediately deep to the insular cortex. That's why I mentioned about the insular cortex. And we have said that this is internal capsule. Medial to the lentiform nucleus is internal capsule. Then between the internal the lentiform nucleus and the claustrum here, this white matter area, very small thin white matter area you can see between the lentiform nucleus and the claustrum, that is called external capsule. It's not very clinically, I don't know how important it is. External capsule. It is called external capsule, but it's not as important as the internal capsule. Okay, just for the matters I'm mentioning. Now you have seen all the basal ganglia. You have seen the caudate, lentiform with its putamen and globus pallidus. You have seen the claustrum. You have seen the amygdaloid here. Okay, shall we move on? Okay, the same thing. It's a better diagram. I was going to show it here, but then later, when you learn about the ventricular system, remember that just medial to the head of the caudate, you get these parts of the ventricular system, cavities. You can see these cavities here. And between the two thalami, again, you have a cavity collapsed here. Okay, so remember these points later. Now here is a better one. You can see the claustrum here. You can see the putamen, globus pallidus, head of the caudate nucleus, and the thalamus. You see the rostrum of the corpus callosum and the splenium of the corpus callosum. Okay, now if you cut this area, if you enlarge this area and draw it in a diagram, this is how you can. Okay, who is shouting? Let me mute you all. Mute. issue is settled. Okay. Now, so this is what I was telling you. Okay. Okay. If you take this area in the square and draw it, this is how you will draw it. So it's a horizontal section through the head of the caudate nucleus, because the head of the caudate is a very good landmark to refer to the section. Okay. So head of the caudate is a very good landmark. So it says that the section has been taken through the head of the caudate nucleus. If you just say caudate nucleus, you can cut at any place. Okay. So it's the head of the caudate through which it has been cut. So this is how you can draw it. You try to understand the diagram. You get the thalamus here. You get the head of the caudate, and this is the beginning of the tail of the caudate. Usually you cannot recognize this in specimens. You can recognize the head of the caudate, but not the tail, even though I draw it here for the completeness. Okay. Because body in the middle lies at a higher level. Okay, it's at a higher level, so that in the horizontal section you cannot cut through the body. Then you have the putamen, globus pallidus, other the parts of the lentiform nucleus. I said this is thalamus, and you have the internal capsule here with this anterior, posterior limbs and the genome. And you can see the anterior horns of the lateral ventricles. Will come back to it, medial to the caudate nucleus. Then outside the lentiform nucleus, you get the claustrum. Between the claustrum and the lentiform nucleus, you get the external capsule that I was talking about. So this is the parts of the internal capsule. This is the parts of the internal capsule. Now the internal capsule has an anterior limb, as I said before, has an anterior limb, genu, and a posterior limb. Okay, so that is the basic thing that you need to know first. Then you can forget about this frontopontine fibers for the moment. Okay, so frontopontine means from the frontal lobe to the pons of the brainstem. Okay, so these are all motor fibers, but you can forget them for the moment. Now the important ones are the rest of it. Now you can see these corticobulbar fibers. So the internal capsule is for nerve fibers, you know that. Now here we are going to look at which nerve fibers pass through which areas of the internal capsule. Now in the genu area, you get the corticobulbar fibers. You can call them corticonuclear as well. Okay, corticonuclear. Now here nuclear means collections of cell bodies. These are the collections of cell bodies of the cranial nerves. Cranial nerves. Cortico means the cortex. So if it is motor fiber, these are motor fibers. So it's the motor cortex. So corticonuclear means from the motor cortex, primary motor cortex, or the precentral gyrus to the cranial nerve nuclei. That's why I said you can call it corticonuclear as well. Now they occupy, these fibers, motor fibers, will occupy the genu of the internal capsule. Genu of the internal capsule. Then you get corticospinal tracts. Again, starting from the motor cortex, going into the spinal cord level. Spinal cord level, and giving rise to motor fibers in the spinal nerves. So corticospinal tracts will occupy the anterior two-thirds of the posterior limb. Anterior two-thirds of the posterior limb here. They are also motor fibers. So in other words, the genu and the anterior two-thirds of the posterior limb are occupied by motor fibers, either corticobulbar or corticospinal. These names you will come across again, you know, when nerve tracts are done and when spinal cord is done. Then further behind, in the posterior limb, you can see this area. This area is for sensory fiber tracts. All other fibers, motor ones are descending. You call them descending tracts. Descending because they go down. And the sensory ones, blue ones here, are ascending. ASCEND, ascending fiber tracts. And all the ascending fiber tracts, there are many ascending fiber tracts, they are compressed together and they run in the posterior limb behind the corticospinal fibers. So these start from the motor cortex. These will go into the sensory cortex. That's what I showed you in one of the previous specimens. So you can have fibers starting from from different areas, from the spinal cord coming from to the different areas, and you will learn this later. Okay, their names, don't go behind their names too much. Okay, then further behind, even behind this general sensory inputs coming from the limbs and the trunk, even behind that you get the visual and auditory ones. Visual and auditory ones further behind in the internal capsule. Actually, they are even at the end of the even after the posterior limb. Yeah, not after, even at the end of the posterior limb, because you get your lentiform nucleus here. So these ones are behind the lentiform nucleus. So if you read books, you will find this area as retrolenticular part of the internal capsule. Still the internal capsule, but behind the lentiform nucleus, which is laterally located here. So if you read, even last says it's retrolenticular. Retrolenticular means behind the lentiform nucleus. Retrolenticular part of the internal capsule, you get visual and auditory fibers. Okay. Then you will later learn about the blood supply of the internal capsule, and if you see patients in the wards, one side totally paralyzed with loss of sensory functions also sometimes, and then you know that it is a problem with the internal capsule, some bleeding into the internal capsule or lack of blood supply to the internal capsule. Otherwise you cannot affect the whole side of a person. If the person is like this, you cannot affect the whole side of a person unless you damage something at the internal capsule. It's a very small area with all the nerve fibers passing through. Okay, then this details about the diencephalon. We were talking about diencephalon even in the previous lecture and in the practical. Now the two main parts forming the diencephalon. Now other point is, if you take the brain like this, I said if you take this whole area, now forget about the brain stem which is here. If we cut the brain stem off, now this whole area, we said we call it cerebrum, and cerebrum has two components, the cerebral hemispheres on either side, left and right cerebral hemispheres, and in the middle, hidden by the two cerebral hemispheres, you get the diencephalon. That's what we say. Now diencephalon consists of two main important structures, the thalamus and the hypothalamus. Thalamus above and hypothalamus below. I'll show you. Then there are other two components to it, subthalamus and epithalamus. We don't concentrate too much on subthalamus and epithalamus, but thalamus and hypothalamus, you should be able to identify in specimens, and you should know their functions and all that physiology. We'll talk about the functions of these structures. Now, when it comes to epithalamus, you get the pineal gland as part of the epithalamus. Pineal gland, which is another important endocrine gland, which controls all the other endocrine glands, including the pituitary gland. Okay, there are different theories about the pineal gland. Now, this is how you identify them. This is how you identify them. Now, this is the area of the diencephalon. This is the area of the diencephalon. Okay, I'll delete it. Now, you can see if you enlarge this, you can see this area is called thalamus. Upper part is thalamus, lower part is hypothalamus. You get the pituitary stalk attached to the lower part of the hypothalamus with the pituitary gland there. You get the optic chiasma also here. I'm not very sure whether it's optic chiasma or you get the optic nerves crossing each other in the same area, optic chiasma. So forget about the optic chiasma. You just remember it as the pituitary stalk for the moment. Okay, pituitary stalk to which the pituitary gland is attached. So that is attached to the hypothalamus. Now, how to differentiate between the thalamus and hypothalamus in a specimen, because you don't get a clear demarcation. If you, in some specimens, you can see a sulcus here running just above the, this is the anterior commissure that we were discussing about. This is the posterior commissure that we're discussing about when we discuss the commissural fibers. You get the pineal gland here. This is the superior colliculus and the inferior colliculus of the midbrain. So you get the posterior commissure between the two. And this is the anterior commissure between the rostrum of the corpus callosum and the fornix, anterior end. So from here, somewhere from the, just above the anterior commissure, a sulcus starts, it ends at the posterior commissure. This is a groove-like area, sulcus. That is called hypothalamic sulcus. Hypothalamic sulcus. Hypothalamic sulcus. So hypothalamic sulcus separates the hypothalamus, the thalamus from the hypothalamus. Okay, so it's not difficult to remember. Some specimens you can see it clearly. Then, okay, this is the hypothalamic sulcus. Okay. Then this is the epithalamus and subthalamus. So epithalamus, I said it includes the pineal gland. So epithalamus is that area. Subthalamus is just below that. There is a collection of cell bodies in the subthalamus, which is called subthalamic nucleus. You don't have to remember all these small points, but I have to mention it. Otherwise, you will not be able to read the book and understand. Okay. So beyond this, you get, this whole area is the midbrain. And this is pons. Okay, I'll come back to it when we do the brainstem. So if you take a section, a coronal section through the pituitary gland, so that means a coronal section through the pituitary gland is somewhere here. No? So if you cut here, if you cut like this through the thalamus, rather, not this. If you cut through the thalamus like this, thalamus and hypothalamus, this is what you see. So superiorly, you will cut through the corpus callosum here, and the roof of the your third ventricle is here. Third ventricle is in this area. You cut through the third ventricle in the middle. This is the third ventricle between the two thalami. Now concentrate on the thalami and the connection between the two thalami, left and right halves of the thalamus, interthalamic connection, and you get the hypothalamus below that. So hypothalamus, usually you don't say left and right hypothalamus. You, even though I have drawn it like this, it's the whole area, because the third ventricle will be ending here, and this whole area would be the hypothalamus. Okay, and attached to its lower end is the pituitary stalk with the pituitary gland. When you learn the pituitary gland and this optic chiasm, either you can call it optic chiasm or optic chiasma. Okay, both are correct. The crossing of the optic nerves, optic chiasm actually lies anteriorly. Even though I have drawn it like this, it lies further anteriorly. And these mammillary bodies, even though I have drawn it in this diagram like this, actually they lie posteriorly. Okay, so I wanted to include it here, but it's not correct. If you draw it, it should be on the posterior side. I'll show you the mammillary bodies are here. These are mammillary bodies. Actually, you know, textbooks describe it. Anteriorly, the hypothalamus is the area between the anterior commissure anteriorly and the mammillary bodies posteriorly. So it's fairly correct. Okay, and the pituitary stalk and pituitary gland lie below it. Okay, so even the optic chiasm lies inferiorly and anterior to the hypothalamus. These are the relations if you read. Then few things about the thalamus. Thalamus is a very important cell station. Very important cell stations. There is a long list of collection of cell bodies there. Cell bodies are called nuclei. I told you. So you get a long list of nuclei in the thalamus. They are all cell relay stations. Cell relay station. And it receives, thalamus receives main sensory tracts, almost all main sensory tracts except the olfactory pathway. So the smell does not go through the thalamus. All other sensory tracts, whether it's general sensations like pain, temperature, touch, vibration, all these are general, considered general sensations coming from the body. Whether they are general sensations or whether they are special sensations like vision or hearing, they all pass through the thalamus. But the olfactory pathway does not pass through the thalamus, it bypasses the thalamus. And the thalamus, it receives this information, sensory information, and sends them to the cerebral cortex, and not only cerebral cortex, uh, cortical areas below the cerebral cortex, which are called subcortical regions. You don't have to by heart it, when it comes, you learn it. Okay, even though I mention it here. And most importantly, the thalamus integrates the visceral coming from the internal organs and somatic functions as well. Okay, so details of it you will learn later. So this is just just to show you the complexity of the thalamus. You can see the left and right sides of the thalamus with the interthalamic connection here. So this area is the area of the third ventricle cavity. So this collection passes through the third ventricle and connecting the two sides. Now you can see the list of cell body collections which are called nuclei. Okay, the long list of nuclei, and when Dr. Himani talks about the nerve tracts, you will find out that some of the nerve tracts pass through some of these nuclei, ventromedial nucleus and all that. I don't remember the names of these nuclei. And when it comes to memory and all that, people will talk about the limbic system. Then you will have, as part of the limbic system, you will have anterior nucleus of the thalamus. So that part would be part of the limbic system, like that. Okay, so you will come across some of these things here and there. Then another important thing here, you see these two collections of cell bodies. Change the color. Collections of cell bodies. This one, it is called lateral geniculate body. You can read it. And this is called medial geniculate body. Now these are actually cell bodies in the pathway of the visual pathway and the auditory pathway. Lateral geniculate body belongs to the visual pathway. Medial geniculate body belongs to the auditory pathway or the hearing pathway. So all these things will be touched upon here and there. Okay. Again, this is another diagram from Richard Snell, Snell's neuroanatomy, to show you the medial and lateral geniculate bodies. And if you cut the thalamus, you see the nuclei even inside, different nucleus here. Ventroposterolateral nucleus, lateral nucleus, all that. Ventromedial nucleus. Okay, you don't have to remember the names of all these nuclei. Then about the hypothalamus. That is the other part of the diencephalon. This I told you, it extends from the anterior commissure to the mammillary bodies in front to back. Almost all physiological activities of the body are influenced by the hypothalamus. Okay, so you will learn these things. You have learned some of these things already. It's integration of autonomic functions, that is sympathetic and parasympathetic integration, regulation of endocrine functions, because you get all these releasing hormones from the hypothalamus coming down and influencing the pituitary gland. Then maintaining body homeostasis. You have learned this homeostasis in physiology, and regulation of body temperature and body fluids, sexual behavior, emotions, drive to eat and drink, all controlled by the hypothalamus. Because these functions are common to humans as well as even lower animals. So they are when it comes to hypothalamic functions, it can go from very high level like humans to go down to low level animals. There are some important cell stations, collections of cell bodies, neuronal cell bodies in the hypothalamus. The supraoptic nucleus and paraventricular nucleus, very frequently mentioned in your physiology lectures. So these hormones, the releasing hormones that are produced by the hypothalamus are produced in some of these areas and brought down. And if you have the hypothalamus like this here, and you have the pituitary gland here, could be like this. You have the uh, anterior pituitary gland, not it's connected through the posterior pituitary gland, but the direct connection between the pituitary gland and the hypothalamus is through the posterior pituitary, because the nerve fibers starting from the supraoptic and paraventricular nuclei, they actually come down into the posterior pituitary. That's why you call it neurohypophysis. When you learn the posterior pituitary, you must have learned it is neurohypophysis. And the anterior pituitary also is under control by the hypothalamus, but that is through the hormones, releasing hormones brought down by the by a vascular system, which is called hypophyseal portal system. Okay, so this is other than the portal system that you get in the abdomen connected to the liver. This is the other important portal system that you get, starting from capillaries and ending with capillaries. You call it hypothalamus to the pituitary, hypophyseal portal system, releasing hormones to the anterior pituitary. Okay, so your supraoptic and paraventricular nuclei must be somewhere here, and your posterior pituitary must be here, and the anterior pituitary separately. The pineal gland, few things about the pineal gland, or you can call it pineal body. It's a backward projection from the diencephalon to lie posterior to the midbrain, so that you have seen. I don't know whether, yeah. So this is the pineal gland. Okay. So this is the diencephalon posterior end. You can see this is the superior colliculus and inferior colliculus of the midbrain. So it lies just above and behind the superior colliculus of the midbrain. Okay, that's what is mentioned there. Now, before this point, now it produces a hormone called melatonin, which is important in maintaining the circadian rhythm influenced by light. So when you get this jet lag and all, it has got to do something with the melatonin secretion, because the pineal gland responds to the day and night cycles and release melatonin, and all other pituitary glands, including other endocrine glands, including the pituitary gland, is under the influence of melatonin. So in that sense, pineal gland is even above pituitary gland, even though it does not produce many hormones. Then the other clinically important point is pineal gland get progressively calcified with old age. So in old people, the pineal gland gets calcified. And since the pineal gland is seen in a mid-sagittal section, you know that it's exactly in the midpoint. So you can actually use pineal gland to get at the midpoint of the brain. Now, I don't have a diagram, but say you work in a very remote place, you don't have CT facility, and there's a person with a head injury. Say you get an X-ray, so you get an anteroposterior X-ray, anteroposterior view of an X-ray like this. If this is the skull can be seen in the X-ray because it's bone. Then you don't see any of the brain parts in the X-ray, but you might be able to see the calcified pineal gland in the center in a normal person. But if there's a head injury and say there's a left side head injury, you will not see this blood clot in the X-ray. Only CT scans will show it, or MRIs will show it. But you will not see this part, but you might see the pineal gland, if it is calcified, shifted to the right side, not in the midline. So that can actually give you an idea whether there could be some pressure effect on this side. So you should take immediate action to send to a tertiary center, do CT and all. But this is very rare nowadays, because basically people don't take X-rays and look for the pineal gland. They transfer the patient to the higher centers. Okay. Now, the ventricular system of the brain is totally different topic. Okay, now we were discussing about the substance of the brain. Ventricular system is a system of cavities inside the brain. So it's in the cerebrum as well as in the brain stem. So you have you have three main or four main components. You have one, you have lateral ventricles. So you have a left lateral ventricle and a right lateral ventricle in the two cerebral hemispheres. Then second one, you have a third ventricle. It means third means this is called the left and right is taken as 1 and 2. Okay. So you have the third ventricle and you have the fourth ventricle. Then connecting up the third and fourth ventricles, you have what is called cerebral aqueduct. Cerebral aqueduct. So that is basically what is called ventricular system of the brain. So the ventricular system of the brain is very closely related to your basal ganglia and stuff. So you should learn it together. Now in this diagram, you can see this is the lateral ventricle. You can see it goes into the, it's like this. This whole thing is the lateral ventricle. Now this part of the lateral ventricle is called the anterior horn of the lateral ventricle, which is found in the frontal lobe. You get the frontal lobe here. You get the anterior horn of the lateral ventricle here. Okay, so here it's not clear. So you get the anterior horn of the lateral ventricle here. Then you get the body of the lateral ventricle here. So it's partly in the frontal lobe and partly in the parietal lobe. Then this projection is called the posterior horn. Posterior horn of the lateral ventricle, which is in the occipital lobe. So this is the area of the occipital lobe. So if I draw with, now this is your temporal lobe, this is your occipital lobe, and this is your frontal lobe. So the posterior horn is going into the occipital lobe, and the inferior horn, this is called inferior horn of the lateral ventricle. Inferior horn of the lateral ventricle, which is in the temporal lobe. So again, it's like just like the caudate nucleus. If you remember the caudate nucleus, it starts from the frontal lobes and ending in the temporal lobes. So it has a very wide distribution in different planes. So if I draw the caudate nucleus, if I try to draw the caudate nucleus here, this is how I can draw it. So this is the head of the caudate. Now this I am drawing this caudate nucleus lateral to the lateral ventricle. Now if this is lateral, this should be the left lateral ventricle. So I am drawing the left caudate nucleus here, head of the caudate nucleus, then the body of the caudate nucleus and the tail of the caudate nucleus. So it's related to the different parts of the lateral ventricle. Head, the anterior horns of the lateral ventricle, head is related there, then the body is related to the body, and the tail is related to the inferior horns of the lateral ventricle in the temporal lobe. So remember this point together with the caudate nucleus. So you know, if you cut on the other hand, if this is the head of the caudate, if you take a horizontal section, a typical horizontal section that you're asked to reproduce in exams, if you cut through the head of the caudate nucleus, of course, you will see, depending on the cut, this cut was slightly, you know, the wrong direction. If this is the head, if I cut exactly in the horizontal plane, you might cut through the posterior horns at the back and the anterior horns of the lateral ventricles in front. This is the posterior horn. So you will not cut through in this plane. This area will not be cut, or this area will not be cut. Okay. So go back to your horizontal section and work it out. And laterally, you will have the head of the caudate. Medial to that, you will have the anterior horns. Okay. Now you can work it out with this one. Okay. And you can see the third ventricle here between the two thalami within the diencephalon. That is the third ventricle. And there is a gap in the third ventricle because for the interthalamic connection which passes through this gap. Okay, so you don't have a ventricle there. And you can also see that lateral ventricles as well as the third ventricle are connected to each other by a foramen here, which you can't see as a foramen. You can see it here also. You call it foramen of Monroe. foramen of Monro Jidre, foramen of Monro here, connects up the lateral ventricles to the third ventricle and to each other. Okay. Then the third ventricle is connected up to the fourth ventricle. This is the fourth ventricle. You get your cerebellum here. You get your pons and medulla here on either side of the fourth ventricle. Third ventricle is connected up with the fourth ventricle through the cerebral aqueduct. Cerebral aqueduct, Silvius Martikal, cerebral aqueduct. So, so if you locate the other parts of the brain, some of the things you have not learned yet. So it is the diencephalon here. You get the cerebral hemisphere here with the occipital, the temporal and occipital lobes. You get the diencephalon here around the third ventricle. You get the midbrain here in the cerebral aqueduct, passes through the midbrain, and then you get the pons and the medulla here with the cerebellum behind. So that's how the brain structures are related to the ventricular system. Then if you look from this side, if you look from above, this is your eye. If you look from above, this is how you see the, I am referring to this one, this is how you see the ventricular system of the brain. So you see the anterior horns of the lateral ventricles, and you get the bodies of the lateral ventricle very close to each other. See the gap between the two. So if you draw the cerebral hemispheres, you will draw it like this, cerebral hemispheres. So to get this, if you want to see this, you have to cut very close to the midline. So you get the body, and this is the inferior horn going into the temporal lobes, and this is the posterior horn going into the occipital lobes. If you draw the brain here again, you have the occipital, the temporal, temporal lobe here, and the it's difficult to draw it here. Okay, so it's the occipital lobe here and the temporal lobe here and the rest of it. Okay, so you see the foramen of Monro must be here, and this is the third ventricle. So the other important point is this ventricular system is connected up with the subarachnoid space. Now we were discussing about these spaces, the meninges and the meningeal spaces. Coming back to it, if I try to draw the skull here, if this is your skull, and if this is your dura mater attached to the skull, now that attached layer is called endosteal layer of dura mater, and it gets separated out. There are two layers, endosteal layer and the meningeal layer. The meningeal layer gets separated out from the endosteal layer to form, we say, dural venous sinuses here. Now this is superior sagittal sinus. Then you get the brain underneath. Try to draw the brain. You get your brain here with its sulci end. I'll draw it like this. So this is midline, two cerebral hemispheres, sulci end, gyri here. Your arachnoid mater is over the surface of the brain, like this, over the surface of the brain, of course going into this one. Then your pia mater is on the surface of the brain like this, attached to the surface of the brain like the visceral pleura. It should be understood like visceral pleura. So you can see this gap. Now if you go for the spaces, I'll take a different color. This is between the skull and if you separate the endosteal layer of dura mater and the skull, that is extradural space or epidural space. And this is between the arachnoid mater and the dura mater. It's subdural space because it's below the dura mater. And between the arachnoid mater and pia mater, this is called subarachnoid space. Now you get the ventricles inside, lateral ventricles and third ventricle and fourth ventricle. Now these ventricles are connected to the subarachnoid space, not through the brain substance here, but through the fourth ventricle. Now at the fourth ventricle here, there are openings. from the fourth ventricle into the subarachnoid space here, from where the fluid inside the ventricular system, which is cerebrospinal fluid, CSF. Cerebrospinal fluid can enter the subarachnoid space from the ventricular system where they are produced, where it is produced. Cerebrospinal fluid is produced inside the ventricles. I'll come back to it later. And cerebrospinal fluid enters the subarachnoid space and fills this subarachnoid space once it comes out. Produced inside the ventricles, comes out to fill the subarachnoid space. And the other point is the ventricular system, it does not stop at the fourth ventricle, continues down as the central canal of the spinal cord. So the cerebrospinal fluid will lie in the central canal as well. And there is subarachnoid space not only around the brain. If you draw the spinal cord, you get dura mater outside, then you get the arachnoid mater. So you get a subarachnoid and the pallidus on the spinal cord. So you get a subarachnoid space surrounding the spinal cord as well. So you get cerebrospinal fluid there as well. Remember that point. So this, in this specimen actually, you can see now the pyramidal is attached to the surface of the brain here. And this is actually, better take a different color. This is actually your arachnoid mater. Okay. So you see these attachments between the pyramidal and arachnoid mater in different places. So the rest of it is the subarachnoid space going into the sulci. So if you put blood or something into the subarachnoid space or dye, you will see the sulci getting filled with that dye or blood, because that space goes down like this. You can see another thing, it's not only CSF, you get CSF in this space. You can also get blood vessels. All the arteries that supply the brain, they travel through the subarachnoid space. So if in case a blood vessel bleeds, if there's bleeding by one of these blood vessels, the blood vessel will bleed into the subarachnoid space here. Blood will be collected in the subarachnoid space here. You call it subarachnoid hemorrhage. You will learn the hemorrhages later, not now. And the important thing is, it's the same space where you get cerebrospinal fluid. Therefore, you can understand that cerebrospinal fluid, therefore, will get blood stained. If you take some cerebrospinal fluid out from your spine, you call it lumbar puncture. You will see blood stained cerebrospinal fluid. You don't do lumbar puncture when you have active bleeding. That's a different issue. Okay. So remember this point. Then the other important thing is cerebrospinal fluid. How do you produce cerebrospinal fluid? Cerebrospinal fluid is formed by what is called choroid plexus. It's choroid plexus. I'll try to show you. Not clear here. Choroid plexus is if you have the ventricles like this. If this is a ventricle, you get the ventricle is lined by ependymal cells. You remember ependyma? Ependymal cell layer. You get the blood vessels outside. Blood vessels will move into the ventricular system with this ependymal cell layer around it. So that's what has been shown here. So you get a blood vessel here with its endothelial cell lining, and outside you get this ependymal cells over the endothelium of the blood vessel. So these two together will make what is called choroid plexus. I'll show you very nicely choroid plexus in the practical. Okay. So these choroid plexus are projections into the ventricular system. Now you get these two lateral ventricles here. So in the flow of the lateral ventricle and in the third ventricle, maybe the roof, I don't remember, of the third ventricle, you get these choroid plexus, which produce cerebrospinal fluid. And that cerebrospinal fluid gets collected in the ventricles, come out from the ventricles through the fourth ventricle, through openings called foramen of Luschka and Magendie. Okay, Luschka, and I'll show you the text. And they enter the subarachnoid space. So then that's how you get the cerebrospinal fluid being produced. So that is the one thing. And this since whatever that goes into the blood will not be 100% allowed to be filtered into the CSF. So this acts as a barrier actually. These two cell layers act as a barrier, which is called blood CSF barrier. So if somebody asks which forms blood CSF barrier, it's the ependymal cell layer and the endothelium of the cerebral capillaries. Okay, it's called blood. There's another one called blood-brain barrier that is between the neurons and the blood vessels. This is between the cerebrospinal fluid and blood vessels. It's called blood CSF barrier, cerebrospinal fluid. So this is a very nice diagram of choroid plexus. So you see the lateral ventricle here, anterior horn, posterior horn, inferior horn is not seen. Inferior horn is here going into the temporal lobe here. So you get the posterior horn, inferior horn, and the body and the anterior horns. Now on this side, choroid plexus has been removed. On right side, choroid plexus has been removed. On the left side, you can see the choroid plexus very nicely arranged. So this is collection of ependymal cells and blood vessel endothelium. Okay. Even here in the third ventricle, you can see some choroid plexus here. Okay. So they are produced inside the ventricles and they travel through the cerebral aqueduct, enter the fourth ventricle, and they go through the spinal canal. They come out here at the fourth ventricle through the foramina of Luschka and Magendie. Foramina of Luschka and Magendie. Then how are they absorbed back? Because CSF is always, all the time, cerebrospinal fluid is produced. There's a volume that you produce every day. I don't remember the volume, it's a very small volume anyway. And they get absorbed back into the bloodstream. Where they get absorbed back into the bloodstream is at the upper limit to the superior sagittal sinus. So you get this dura mater separating out and forming superior sagittal. This is skull. And this is dura mater. You get superior sagittal sinus. Here, superior sagittal sinus. At the superior sagittal sinus, there are what are called arachnoid granulations. Arachnoid granulations. You can see the arachnoid granulations here. Arachnoid granulations. So at arachnoid granulations, CSF from the subarachnoid space is absorbed into the dural venous blood in the dural venous sinuses directly into the venous system, like lymph getting back into the bloodstream at the neck, root of the neck. So how the arachnoid granulations are formed, you can imagine. This is how the arachnoid granulations are formed. Now this is your meningeal layer of dura mater. This is your endosteal layer of dura mater. This is your superior sagittal sinus with blood. Now this is your arachnoid mater. This area is your arachnoid mater. Now the arachnoid mater projects through the meningeal layer of dura mater into the dural venous sinus, superior sagittal sinus, and the CSF is pushed into the or secreted into the superior sagittal sinus. So it starts from core, it's produced at the choroid plexus and absorbed at the arachnoid granulations. Okay, arachnoid granulations.